So somebody asked me, actually a lot of people have been asking me, how do I get rid of Indian dimples? Indian dimples? And the first thing I thought was, what is that? It sounds kind of insulting, if anything. And then I kind of Googled Indian dimples, and I see a lot of K-pop stars with a big depression right here. If you have this so-called Indian dimple and you want to get rid of it, I will tell you my thoughts about this anatomic feature and some proposed solutions. So stay tuned. Hi everybody, I'm Dr. Jonathan Zelkin, a board-certified plastic surgeon in Newport Beach, California, here today to tackle another issue that seems to be plaguing our society, which is Indian dimples or an Indian band. This insulting sounding term actually is a little bit more endearing than it sounds, and it refers to something that we in the industry call a mid-cheek groove or a malar groove or a mid-cheek depression, and essentially causes a defect or a dimple in extreme cases at this part of your cheek. The malar groove or mid-cheek groove, also known as the Indian dimple, can be explained anatomically, and this should serve as a basis for our treatment algorithm. So let's start with the anatomy of the face. What causes a dimple? What causes a groove? In the simplest of cases, you can have a muscle defect, for example, in the sides of your mouth, so when you smile, you get a dimple or basically soft tissue getting pulled in where there is no muscle. In the midface, that may not exactly be the case. What causes this line in the midface? We see it in young people and we see it in old people. I have two kids who are toddlers, and they both had a definitive line here when they were younger that seems to be going away. So it can be a very extremely youthful feature. But why do they have this, and why is it something that's more customarily found in the aging face? What causes the so-called Indian dimple? First and foremost, it's not really a dimple. This groove in the midface has to do with soft tissue in the midface that is being tethered at the midpoint. And that tethering is not truly a dimple, but it's a point of fixation that could be thought of more like cellulite than a true dimple or defect. So if we look at the facial skeleton, we have an orbital rim, and along the orbital rim you have a confluent ligament called the orbicularis retaining ligament. This ligament starts at your tear trough and continues all the way out to the corner of your eye, and this ligament causes a tear trough deformity when you get fat under your eyes that starts to fall out over it. It's a hard stop. It's almost like the underwire of a bra. Below that, there's another zygomatico or a zygomatic cutaneous ligament that is more spotty in nature and continues down along the lower border of your zygomatic bone, and it's also a point of fixation compared to soft tissue that can move above and below it. When you have any sort of excess above that hard ligament, which is kind of tethering the soft tissue, the skin and fat inward, and you smile or you do certain things, that point of fixation can accentuate fullness above and below it. Below this line, you have your nasolabial fold or your nasojugal groove. Above it, you have the malar area or the prezygomatic space, as we call it, which can manifest as festoons in either older individuals or people who've had surgery or trauma, where you get a residual swelling in this area. In the case of the so-called Indian band, you have points of fixation from the lower aspect of your zygomatic bone facing upwards, and you have excess skin and fat above it, and you have excess skin and fat below it. Sometimes when you smile and you have a muscle that runs through that ligament to the corner of your lip and it pulls it up, it can actually accentuate this feature. We see it a lot in patients of Asian heritage. We see it a lot in Hispanic patients. It's honestly common amongst all races. It is not an abnormality. It's not a true dimple, but if it bothers you, we have ways of treating it. When we perform lower blepharoplasty surgery or facelifts in the older patients that we treat, we typically will disinsert a lot of these ligaments and resuspend the soft tissue to address that. Or in conjunction with, we can actually volumize this area by putting fat amongst this ligamentous band or beneath it in the prezygomatic space. When you do that, you are essentially pushing these areas of tethering forward. This is probably the best strategy for the younger patients who want to correct this issue. If it's a dynamic issue and when you smile you accentuate this groove, you can try things like Botox, neurotoxins to paralyze muscles which accentuate this. The obvious downside of doing that is it can give you an abnormal smile or make you look like you have an asymmetric smile. It can make you feel funny even if you look okay, and it may not be the best solution, but it's relatively safe. With time it gets reversed, and if you like it, great, you found your answer. The next step up, if you're not quite ready for surgery, is to attempt fillers. I wouldn't over-volumize the area or keep chasing this goal by adding more and more volume to the midface, because if you get above and below this ligament but not within the ligament itself, you can actually accentuate the groove by adding volume above and below this area or crevice. If you get it in just the right spot and it works, great, you're done, you fixed the problem. The most tried and true method I use, however, as a standalone procedure would be either fat grafting to this region in the deep fat compartments underlying the prezygomatic space, or disinserting these ligaments through a lower blepharoplasty incision, sometimes from the inside of your eyelid, and then fat grafting the area. Those two solutions are unintentionally how I treat this in almost every facelift I do, and when people want more volume in their cheeks, it happens to correct this so-called Indian band as well. However, in some cultures, this is considered a youthful feature. I personally think it's really cute, and as a standalone issue, I don't think it deserves to be treated. However, if it bothers you, those are the potential anatomic explanations for why it occurs, and those are my subsequent proposed surgical and non-surgical solutions. Thank you so much for taking the time to watch this video. In close, you'll see a before and an after of a beautiful woman who had these, and while I attempted just to simply volumize her midface, I noticed in this patient that it also happened to correct these so-called mid-malar grooves or Indian bands. Thank you so much.